Hospitals in the southern parts of the Strip are facing power outages as generators run dry. Sick and wounded patients face certain death if supplies aren't allowed in. The director of the Kuwaiti Hospital in Rafah has urged the international community to provide desperately needed fuel.
The Zionist aggression is ongoing against our people in Rafah. The Israeli Zionist forces hit more than half of the area, and the world's still silent and unable to intervene. We're now in the Kuwait Hospital, which is the only operating hospital in Rafah, and it operates as a reception point 24/7. We're sounding the alarm and urging the International Health Organization to live up to its responsibilities and provide the hospital with the necessary fuel to power the generators. We want to urge every organization to live up to their responsibilities. The Palestinian people must not be left alone to face their fate. This hospital is still operating and has never been evacuated. We'll continue our efforts for the sake of the patients, and we're now trying to establish a field hospital as soon as possible.
Well, let's speak to Bridget Rochios. She's a midwife from the United States. She's now been in Gaza for a month, working at the Emirati hospital. She joins us now from Deir al-Balah. Bridget, I understand you've been working at the Emirati hospital, which is in Rafah. You're now speaking to us in Deir al-Balah. Does that mean you've been evacuated?
I've not really been evacuated quite yet, but as the invasion continues into Rafah, there has been a huge displacement of patients, of people. Over 800,000 people have been displaced from Rafah. So the census at Emirati Hospital, although still active, is now low.
Bridget, you're a midwife. Can I ask you to reflect a little on what you've seen during the course of your work over the last month?
Yes, at Emirati Hospital in particular, I've seen the birth of so many babies. Emirati Hospital a few weeks ago was the last functioning maternity hospital in all of Gaza Strip, not just Rafah alone. I have seen women who consistently have not had any prenatal care throughout their pregnancies, women who do not get adequate postpartum care, women who are suffering through kind of immense tragedy and pain as they're in this moment of their lives that's very significant of giving birth, where there's supposed to be a lot of joy and love and support. I have seen a lack of supplies turn into no supplies in hospitals. It has been not only at Emirati Hospital, but across the Gaza Strip. The healthcare situation has become beyond catastrophic.
Obviously, when you're dealing with any kind of complications around birth, a lot of babies will need additional support. You talk about that the lack of supplies. We know there's been a lack of fuel. We know there have been babies who need to be incubated, for instance. What is the situation right now?
Yeah, I think you make a really good point when it comes to fuel. Fuel, I think, especially in a Western context, we think about it just for transportation, but it's really important for everybody to know that fuel is literally what is running the Gaza Strip right now. Fuel is how we have electricity. Fuel is how hospitals stay on. Fuel is what allows incubators to stay on. And with the closing of Rafah border crossing and the complete dwindling of supplies and fuel into Gaza, we are constantly at risk of everything shutting down, of babies dying because their incubators aren't working. We know that there's over 10 million tanks of fuel waiting outside of in Egypt to come into Rafah, and it is not here, and it is so necessary.
Bridget, we understand there is some aid, including something, what's supposed to be 4 tankers of fuel now on its way into the Gaza Strip. As a medical professional, do you know where any of that might be going? Have you been informed of who's going to receive any of these supplies?
I don't have specific knowledge of that, as I don't operate in logistics, but I know that fuel is always prioritized to hospitals.
Sure. Bridget, you spoke about watching the births of so many children and so many women going through that experience in a very traumatic time of war. Can you explain a little bit to our viewers about what that does to a woman? I imagine, as a woman myself, I can't even imagine giving birth in a war zone, let alone what's happened in Gaza over the last 7 months. That obviously has not only physical but mental consequences too.
I think it's really important to think about the framework of reproductive justice. Reproductive justice is a is the notion that women deserve to give birth safely, they deserve access to health care, and that they deserve to raise their children in safe environments. Reproductive justice does not exist in Gaza because of Israeli military violence, because of the over 20-year-long almost 20-year-long siege that has been going on in Gaza, because of the lack of resources, because of the constant violence. Emirati hospital they were delivering over 1,000, almost 1,200 babies a month a few months ago, and now our census has dropped completely, and that's because patients have not only been displaced, but they are afraid to go to the hospital. Israel has had a systematic attack on all healthcare systems. Not one hospital has been left unscathed by their violence, and this is extended to also the systematic killing of healthcare workers. The women physiologically need a safe place in order to go into labor, in order to feel safe in their bodies and having a baby, and none of that exists here.
Bridget Rochios there, a midwife from the United States, speaking to us there from Gaza, where she's been working for a month at the Emirati hospital. Thank you so much for your time, Bridget. We wish you all the best with your work.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.